Remember when the president was trying to sell his plan? He said this a lot of times.
First, no matter what you've heard, if you like your doctor or health care plan, you can keep it. If you've got a doctor that you like, you will be able to keep your doctor.
If you've got health insurance, you like your doctor, you like your plan, you can keep your doctor, you can keep your plan.
If you like your doctor, you can keep your doctor.
Nobody is talking about taking that away from you.
Oh, really? Well, we received a lot of emails from our viewers saying their doctors were considering quitting their practice because of Obamacare. Why would they do that? Well, we're going to ask. Dr. Joseph Scherzer is a dermatologist who just sold his practice in Arizona. Dr. Kathy Hansen, general practitioner from Houston, she's had to lay off employees and is struggling to keep her clinic open. And Dr. William Pentz, a Philadelphia cardiologist who may have to give up his private practice and end up working at a hospital. I want to say thanks to all of you for being here. Dr. Scherzer, you actually posted a sign outside your office. We've got a shot of it here. And it says this. It was just a reminder to your patients. It says, if you voted for Obamacare, be aware that these doors will close before it goes into effect. That didn't turn out to be an empty promise. You actually said, that's it, I'm done. Why?
It never was an empty promise, and I never expected this picture to come back 2 years later, but here we are. Obamacare is a threat to the practice of medicine. It's a threat to doctors, and these threats have been going on for 20 years. This is what the public doesn't understand. There are swords of Damocles hanging over doctors' heads. In the 90s, early 90s, the coding system for what we have to put into charts changed. And it is so complex, you can't comply with it. For example, if a pulmonary doctor sees a patient and writes a social history down, that was enough. Now he has to put the dates of the social history down. If he doesn't have that information in the chart, he can be fined $11,000 for that claim. And the system lets the government send auditors in who can charge you a percentage of all the charts that they evaluate. And literally, I could be finding myself beholden to the government for over $2 million if they wanted to find things like that to charge me with.
And they were also going to hit you with the cost of installing electronic medical record system?
A computer system would cost anywhere from a minimum of $25,000 for my old office if I just wanted to install new software right now. You never know if that software is going to be viable 2 years from now. If a doctor doesn't have a computer system, you're talking easily $50,000, $70,000. And at a certain point in time, when you have these threats of massive fines hanging over your head, when your kids aren't in college, do you really want to deal with all of this? We're here to practice medicine. Everything that the government's been doing, and especially now, impair our ability to do it. And we went into medicine to do a job that we thought was intrinsically valuable, and it's been turned upside down.
Dr. Hansen, you have decided not to take Medicare, Medicaid patients because they don't even reimburse you for the actual cost that you have in providing the care. Why do people not understand that?
They don't know what we're really being paid. They don't understand the EOBs that come in the mail.
What's an EOB?
An EOB is an explanation of benefits.
Okay.
So you get something from your insurance company or your Medicare statement, and it tells you what the doctor charged, what Medicare or your insurance company paid, what your copay is, and what's left over that everybody writes off. So I can charge $100 for a visit, but if my contracted rate with either Medicare or an insurance company or Medicaid is $25, I write off $75.
75% of what it actually costs you.
Yeah, and some plans you write off, typically our average write-off in our office is 40%. So we get 60% of what we charge, and that's across the board. Some plans pay a little more, some plans pay much less.
So if the government gets more involved in health care and they expand Medicaid, and that's where these 30 million new patients come from, that means those patients walk in and you lose roughly 40 cents on the dollar for what it's actually costing
Medicaid's
you to provide.
even worse. I think it's 33 cents on the dollar.
So,
but the problem is there aren't enough Medicaid providers already. I never went on Medicaid. I walked the circle of buildings when I opened my practice 16 years ago, and the pediatricians behind me said, "Are you on Medicaid?" And I said, "No." They go, "Well, don't get on it. It's too much paperwork. You'll never break even." Medicare this past year in November, our practice had to make a decision to stay on Medicare or not. I've been on Medicare my entire life. 15% of my revenue was Medicare. They were threatening 27.4% cuts. My accountant said, "You either need to close, sell out your practice, or stop taking Medicare."
So all this promise that the president's going to take care of more people, he's not if you guys quit. All right, Dr. Pentz, you're a cardiologist in Philadelphia. You've been a part of a practice. it's been so tough to make it. I mean, most people think, oh, cardiologists are rolling in dough. You and your partners had to reach into your own pockets just to pay your employees last year. That's a shock, I think, to most Americans, that there's really no money being made in your practice.
Right. Cardiology has been particularly affected by Medicare. Back in 2010, Medicare made devastating cuts to testing that's done in the office. And that's resulted in approximately now about 75% of cardiologists are employed by hospitals. Private practice is quickly dying out. And you know, our reimbursement went down severely. Our expenses continue to go up because of all these complex Medicare regulations for billing. We still have to maintain a fairly large staff, so the expenses keep going up. What you're getting paid is going down. Right now, we're not getting paid enough to maintain a viable business. And it finally got to the breaking point recently where 4 physicians have left my practice, one of whom was probably one of the best physicians I've ever worked with. Just was so frustrated, he just quit, and he doesn't even have a job. And whether he returns to practice or not really remains to be seen. And it's quite upsetting to the patients. We have people calling in tears, you know, that their doctor has left, and our staff is having to spend a lot of the time on the phone.
Well, what's so tragic about this? You guys went to college, then you went to 4 years of medical school, did an internship, 3 to 6 years of residency, then establish your practice and actually learn to be really good at what you do. And at the peak of your careers, this policy that's supposed to be so wonderful is causing you to say, I can't do this anymore, and you're making less than members of Congress. I don't think people understand that doctors are not getting rich anymore. Doctors are, on average in this country, they earn less than members of Congress. And with all due respect, what Congress does ain't nearly as important as what these guys do. So when we come back, we're going to do something that President Obama should have done but never got around to, and that's listen to the doctors as to how they would fix health care. That's what we'll discuss when we come back. Stay with us. Let's talk about the reactions you're getting. Dr. Scherzer, what kind of reaction have you gotten from your patients when you said, I'm done?
I had patients very upset, but they understood because I've been vocal about this for years. I was like a racehorse trying to get out of that gate with putting my mind in full gear when I had a patient in front of me until the government came into the fold. And it's gotten worse and worse and worse. And I can't put out of my head the fact that every time I saw a Medicare patient, I was at risk for an $11,000 fine per patient. My patients understood full well. I had cards thanking me, to my surprise, and it's not something I did lightheartedly, but I was fearful of being bankrupted by the system.
Dr. Hansen, if you were talking to a young person today, would you advise them to go into medicine?
No, I've already done that many times.
You've told them not to do it.
I have a nanny, Michigan State grad, math, smart girl. She came down, sat with my kids in the summers, got her a job at NASA for a couple of summers, and she was thinking about doing medical school because of a couple of her friends. And I said, Cheryl, don't do it. Now I regret that, you know, because I want the ethical people to be in medicine. But I told her, I said, you're going to be a government employee. You're going to be under the system. It's 10 years of your life, your 20s, that are taken away from you as far as anything real social. And so she's in biomedical engineering, just graduated from USC in master's. But I felt bad after. In hindsight, I kind of wish, oh, I should have told her to go, because I want good people in medicine, but there was no way I would encourage it.
But you want to be honest with them, and you want to tell them that if you do this...
Yeah, I tell them they have to love medicine. It has to be a calling, just like being a pastor or a teacher. You will never do it for the money. You will never do it for the heartache. You will only do it because you love patients.
Dr. Pentz, there's a likelihood that you may have to get out of private practice completely. You would then end up being probably the employee of a hospital.
Right.
What are the disadvantages to the patients if you no longer are in private practice? Because, you know, I don't care what the hospital thinks or even what you think. How do the patients get affected by that?
Well, the patients definitely are affected. It does become an access to care issue. The question is, you know, does the hospital have the resources to accommodate all these patients now who need testing done? And the hospitals may not be geared up to handling that many people. The other issue is if you have the test done as an outpatient in the hospital, your copay is higher as well. And the reimbursements for these same tests that are done in our office that are done in the hospital are much, much higher to the hospital. So Medicare pays a lot more money. So it's actually costing Medicare a lot more money to have to pay for these tests to be done in the hospital.
So both as a taxpayer, we're going to pay more, and as patients, we're going to pay more if this is the shift. Let's talk about your prescription. If you could fix Obamacare and write the prescription, and granted, maybe we could even read it.
Well, we have to do it electronically.
We do it electronically. Dr. Scherzer, what would your prescription for Obamacare be?
I'd make health care expenses tax deductible across the board, get rid of the employer-based health care system, make people responsible for their own payment, have Medicare savings, medical savings accounts, have a high deductible plan in progress for catastrophic care, get the government out of this as much as we can, put the patient in control.
I like
that. Talk to the doctor.
Dr. Hansen, your prescription, if you could write one today.
One thing that I really wish someone would do, and no one really talks about it, is this information. One of my doctors left this month, or in May, and she went to a big system, and some of her patients have not followed her, and I asked why, and they say, well, I don't want my information out in a big system. So she's in University of Texas, I'm a small clinic, it only stays with me. One of the things that frustrates me is there's a lot of duplication in medicine, especially in primary care. They just got out of the hospital. I have no idea what their labs are. Well, yeah, we signed a record release. No one brought them over. I've always wanted the patients, if they could somehow in cyberspace have their own folder that they own with their medical information. We could access it from our computers in the office. They pull up their CAT scan from the hospital. But it's not their hospital system. You understand? It's they get to choose what they want. They get to choose who has access to it. Because we have so much records that sometimes are very inaccurate. And you can check on electronic records now, normal exam. Well, if you put normal male instead of normal female, and you don't catch it, it's in their record. And so there's a lot of duplication of records, there's a lot of misinformation of records, and that's at the core of where I am. I'm exactly like him. Let the patients pay me $50 or $60. They pay that much to get the oil change in their car, but they come in and go, well, it's a $10 copay, I don't think I have it today. They don't really realize that we get paid so little from the insurance companies. Their copay is basically our cash flow for our business. And it's hard.
That is. Dr. Pentz, your prescription for Obamacare.
To me, malpractice reform is a huge issue. It's been estimated by some that malpractice adds an extra $50 to $100 billion in healthcare costs. And I think even in Washington, that's a lot of money. And just think of how much healthcare you could provide with that amount of money.
Well, I want to say thanks to all of you, your candor, your honesty, but most of all, the clarity of your answers and helping our audience, both here and at home, understand this is a crisis. And it is a crisis that has been caused by government, not fixed by government. And I hope people are paying attention, and I hope they're listening. We kind of grew up believing we ought to listen to our doctors. Well, folks, we ought to listen to our doctors. And our doctors are not happy about Obamacare. Do you think maybe that they know more about the practice of medicine than President Obama does and the members of Congress? I certainly trust them a whole lot more. And the fact that they've worked this hard to be as prepared as they are to save our lives, and we're making it harder for them, this is absurd. Please make contact with your congressmen and your senators. Let them know that you're not going to be happy when you can't go to your doctor because he's out of business. Again, thank all of you for being here. Really a pleasure to have you.
Thank you.